And happy Aloha Friday. Welcome to the COVID-19 Care Conversation with me, Angie Denise, and Ryan Kalei-Suji, a conversation that is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health here on the platforms of the Honolulu Star-Advertiser. We're so happy to be here with you this Friday. We have so much to talk about, big announcements from the state, Ryan, and we've got a guest here to debrief us on all of it.
That's right. Lieutenant Governor Josh Green will be joining us in just a few moments to talk more about the lifting of the 14-day quarantine for those trying to enter the state of Hawaii. We know that there's a lot of questions and that there have been a lot of comments that actually came in yesterday in our broadcast as well. We're going to try to get to as many as possible. So we encourage all of you who are tuning in, please let us know where you're watching from. List your comments here, and we will try to get to as many as we possibly can during our time with the Lieutenant Governor. And in fact, we're going to bring him in right away because we know that there's a lot of things to talk about. Good morning, Lieutenant Governor Josh Green. Thank you so much for joining us. First off, let's talk a little bit about the plan that was unveiled a few days ago in the press conference that you had announcing this 14-day lifting of the quarantine for out-of-state travelers. We know that there are a lot of things that are still being worked out and there's a lot of question marks that are still coming in. But overall, can you talk to us about how this plan just sort of formulated and sort of where we are at now, and if there have been any developments since the announcement was made on Wednesday?
Sure. Well, thank you for having me. Tons and tons to report. About 3 weeks ago, when it became clear that the pressure was mounting on the governor and people all across the state, the legislative leaders, everyone, that sooner or later we were going to open, no matter what, because people are struggling. And we have had an extraordinary run of success, knock wood, even though the numbers have been a little higher lately. We have not had a fatality since May 3rd, which is unheard of in America. I mean, completely unheard of. And the numbers have been flat. I knew that the pressure would amount with 22+% unemployment, over 30% unemployment on Maui, when you've got other potentials like 30 to 40,000 people that could lose their home, could be evicted. The pressure was mounting, but we cannot and could not let our guard down on safety. We can't allow a surge to come across Hawaii like it's happened in Florida or Texas or California, because we have limited healthcare capacity. We have eventually a lot of people that will be visiting. It's just too dangerous. So I began to socialize the idea of a test to greatly reduce the possibility that travelers would bring COVID, the actual virus, into our state, because there's no perfect way to stop it otherwise. We have absolutely the natural barriers, the Pacific Ocean, the quarantine, and so on. So I floated the idea, and at first people thought, well, it's going to be too cumbersome, and can we really pull it off, and so on. But when they realized that we were caught between two impossible situations, one, the governor had to have or needed to feel that we had a way to protect our people. He could not allow us to open without having a protection in place, because we've done well and we don't want to kill people. And there had to be an opening because we cannot continue we don't have money. We cannot continue to keep people alive, keep the hospitals open, keep schools from closing, keep people from leaving. There had to be a solution in the middle. And so I proposed testing, and then Alaska and some other countries proposed a plan and started to go down that road. And it began to get traction. And I just simply explained to those who wanted to open sooner, certain businesses wanted to open sooner without any testing provision. I just said, you're just not going to get that date from the governor. It's not possible. And then to the governor and others, I said respectfully, there's no way on earth that you can't open at some point. I mean, some point we're going to open. So what do you do? So what you do is you do all the things the Department of Health is recommending. You're going to screen for temperature. You're going to do thermal scanning. You're going to do all of the history taking to be able to trace people. You're going to enhance tracers. But that still leaves you in a place with hundreds of thousands of people that are going to start coming in here, and you can't have them spreading COVID, because then we would reject tourism. Our people would reject it categorically. So the answer became evident, which is to mandate a test within 72 hours. This is the plan. Mandate a test within 72 hours of travel. It's not simple. We're going to go through the details. Or you go to quarantine. That's simple. And when people realized that getting a test, because the test is PCR test, regular test, is reliable. We're the ones we're using it. We've taken 73,000 tests in Hawaii already. 668 or something have been positive, right? About 1%. When you have that test and you've reduced the probability that anyone traveling here is going to be positive, it gives you the available message that you can open and you can bring back tourism and you can open hotels. So that's the plan. Now, we had to also make it feasible because I got a lot of pushback right off the bat. Well, where are you going to get the tests? So the truth is that has not been easy, but I entered into conversations, one of which happened this morning at 8 with our team and CVS. CVS has agreed to test nationally, 1,400 spots across the country to test. And you won't need a doctor's order. It's called a business-to-business testing program. So you'll be able to go to a CVS, say, I'm going to Hawaii. You will pay probably $160, and then you'll be tested. And within 3 days, fingers crossed, you'll get your result in time. If you don't get in time,
that is confirmed. The CVS testing is confirmed that you were able to confirm that?
I would confirm that we have no problems with them. We're just finalizing the details.
Got it.
And there's a lot of nuance. They have to set up a special program for the state of Hawaii. I will also tell you that we're now in conversations with Walgreens, with potentially Kaiser for their members at the very least, and we'll be going to the labs too, the national laboratories, to also make it available. And tests are getting more and more available, actually. Now, we have to make sure we do a PCR test or, in my opinion, a molecular study, which is also very reliable. Not the antigen, not the antibody tests, the PCR tests and molecular tests. Those tests are good. They will reduce our concerns that we have people coming in here positive. So that kind of process has had to go on. And it's a lot of work, which is good because we need to do the right things. It also requires a lot of coordination, of course, with airports, Department of Health, and so on. But to give people an idea, and we can talk about the numbers if you'd like, but to give people an idea, right now, Alaska is giving us a lot of good data because we're seeing in real time what they're doing. I was on the phone with them at 4:15 this morning, which is 6:15 their time, okay? So working out the details. Alaska has found so far that 1 out of 376 people, I mean, they've done 5,000 tests in the last 7 days. 1 out of 376 people ended up having to be tested there and tested positive. So we know that that's about the number of travelers out there that are testing positive, plus or minus, okay? So if we had 15,000 people return, half of our regular per day, 15,000 people, half of our regular tourism numbers, that would be about 45 people if we did nothing that would come through our gates. We wouldn't catch them because they're asymptomatic, but positive. We have 45 people walking around new every day with COVID, could spread it. But by getting a test, if you reduce that number by 70 to 80%, because you test everybody, they test positive, they're not coming. They don't travel. They stay home. Those tests will reduce that number of 45 or so down very significantly, and it's much more manageable. That's the premise. And we'll still do everything else that's possible to screen and test and trace. But this gives us the advantage, and that's the plan. Now, if it's not ready and set up, we'll have to do even more hard work to get it to go, because as soon as unemployment dries up from the feds, all these other things, we're in trouble.
Well, let's get to some viewer questions. The very first one is one that I was also thinking. Aaron Pollock is asking, what are the chances of someone faking the corona blood test, and how will it be tracked once they arrive? So how do we verify that this, does CVS, take that as an example, would they send the results directly to the state? Is this a printout that someone brings to the airport? And who's actually doing the verifying? Is it TSA? Is there a state worker that meets you at the airport? Is it the airline themselves? How does this actually work?
So it'll be part of their screening process. They will have to show us their negative test, their result. If they don't show it, they still go into quarantine. And yeah, I guess people can counterfeit things. If they do, they're going to be subject to a $5,000 fine or up to a year in jail, because they're going to have to sign the testimonial that all of this information is factual and correct. My personal opinion is probably about 1 in 500 people are that stupid to test the system and produce a fake document for a vacation that they're also going to be penalized for. And if you take that number, something like that, it's going to be a small number, but let's just say some people are cheats and they do it. That times multiplied by, we're doing the epidemiology here, about 1 out of 350 people that are asymptomatic positives that we can't catch. the number goes unbelievably low. You're now talking about one in like 30 or 40,000 people that would be sneaking through here. And that would mean maybe one out of every 2 or 3 days, somebody might come through that's positive. You can't always be perfect, but we would be able to follow up. And if we did see someone that we felt was breaking quarantine or we had a complaint about, we can check for their record. And if we do, and they're lying, they're going to face a very significant penalty. One of the early benefits of having big relationships with, say, CVS or Walgreens or whomever, will mean it's much more possible to actually do the follow-up, go and say, in your database, did Jack Murphy get tested? And was that test negative and confirmed? We are going to have to be able to let people from Iowa or faraway places that are more rural get a test at their local lab. And as long as they follow the criteria, which is going to be a PCR test at a CLIA certified lab, that's the standard, then we will look at it and check it. I mean, we will verify it, and it will be, yes, someone on Ford's team, whoever's doing the intake, will check that. I think that we'll actually have a bigger problem with people still not adhering to quarantine. I think that's always a big question for us. And it's an imperfect situation because just setting up a quarantine hotel, which people often recommend, doesn't really seem legal and feasible ultimately. It's something we have talked about a lot. I could see us having a holding area where somebody, if we ultimately wanted to test everybody that was a straggler and didn't get their test on the same day, you're probably getting that question a lot. Like, why don't we just test on the day that people arrive? Well, let me give you the answer. Let's say we're getting half of what we normally get. That's a fair assumption over time, okay? That's 15,000 people every day. We only can do 5,000 tests a day at max right now. So we can't test everybody. And if we only had 5,000 people come in, the hotels that won't open, the airlines won't set up their business, we won't get people back to work. So that was not a viable possibility. But let's say just 1,000 people out of the 15,000 haven't gotten their test done. If it suits the governor, and I'll keep proposing this, we can set up some testing because we never get anywhere near our 5,000 number. The highest number I ever saw as test was 2,300 in a day, ever. So we do have some capacity, and we'll always keep capacity if we have a surge, but we have some leeway. The truth is, it's a lot of work. It would be tough at the airport. When the time comes that a rapid test is easy, like a cheek swab, and you can get the result in 6 minutes, or you blow into something like they're doing out of Israel, that test, when that becomes viable and is proven, absolutely. If we find a equally accurate and very cheap method, we'll use that till kingdom come. And that technology seems to be coming every week a little bit better. So I'm hopeful for that, but all I'm trying to do is chop down risk each time. First it was, don't have cruise ships come. Then it was make sure we tested people so we could actually see where they were. Then it was the lockdown, which really worked, although crushes the economy. Then finally testing people before coming in really brings that number down. And that's the road to success for us.
You were talking about a lot of the guests coming in from the United States and getting potentially tested at CVS. Lindsay asked a question about international visitors and where can they get a test that is from an FDA-approved lab. How will these international guests that maybe aren't a part of these travel corridors or bubbles that we're trying to set up as well, how do they go through that process, and how are we accrediting the tests that they take and verifying those?
That's a great question, because I had a question from a gentleman in Australia already. Now, Australia may be a travel bubble with us, so that sets that aside, right? So let me be clear about that. The governor's working on deals with Japan and other countries that have low risk, low prevalence of COVID-19. So we will set up a seamless travel process with them, which is really good. For those places, we won't need a test because they don't have a high rate. So that's great. But let's say you're coming from Lithuania, okay? And you're coming in, you're the great Lithuanian travel coming to Hawaii to spend your money. Well, we will have to have the PCR test that is accepted. And if they have a PCR test from their local lab, we will accept it. It has to be, the good news is the universal language is science, right? So a PCR test here versus in Lithuania versus Spain versus New York is the same. So it might be run by a different company, but the technology is the same. So if people get a PCR test, it'll be fine. I will tell you, honestly, the process is almost as important as the result. People going through a process, knowing they have to get a test, that they have to verify it, and then they travel and they spend thousands of dollars to come here, that limits the number of people that are willing to take risk and expose us to COVID very significantly. That is a mechanism that I've been using implicitly to keep us safe, because every time you have another kind of hoop to jump through or another process, it's one more level of security. Like, a lot of people are going to say, wait a second, I've had a fever. Can I escape this whole thing and get in? Well, probably not. They're going to get caught with their fever. So they shouldn't travel sick. We know that that's the right thing to do. But now, since we're going to actually be checking it, it'll work. That's exactly the principle that was applied after 9/11 with TSA. A lot of layers, pretty basic, and it worked to keep, tragedy from occurring.
April has a question here. April Reicher says, do children need to be tested? We know Hawaii is a very popular family destination. If you're a family coming, let's say, from California, does mom, dad, and 2 kids get tested, or is it just the adults?
Well, if we were doing what I want, I would not worry about children as much. As long as they are in the care of those parents, I don't think it's necessary. We haven't finalized that policy yet. There are 2 different competing policies right now, and they're moving targets. Right now, Iceland, who is the most comprehensive as far as testing in the world, they are saying anyone who's 15 years and younger does not need to be tested. They don't pose a significant public health risk. They've done a very good job. And then Alaska, when they first initiated their program, they actually have been testing everyone over age 2. And I think there probably is a happy medium. I think probably age 12 is the sensible place, because that's when young people are coming of age and they become higher risk, in my opinion, of spreading and mixing with people and so on, and being potential, multiple point spreaders. We'll finalize that in the next week or 2. And then we'll be able to give people lots of advance notice. I really don't think that they're a significant threat, and having a family of 5 pay $160 each, if that's the price in their region, is much more significant than having a family of 5 but only 2 people having to pay it and being just as safe. So for, I think, would you say her name was April? Yes, that is being worked on right now, and I've even been discussing that with Alaska. So it's not a finalized call yet.
We're getting some other questions specifically, so we're going to try to group these together. Sarah's asking about local residents returning. Joan's asking about college students coming back to school here. So let's kind of dive into the local aspect of it. Some people saying that if I'm traveling away and I go, to Nevada, to Las Vegas, and I come back, and I'm only going for 3 days, one of the things that were proposed or was mentioned on Wednesday was that you come back to Hawaii, you get a test, and you kind of quarantine until you get those results back. Is that sort of still the plan for those who are maybe doing a quicker turnaround with trips to the mainland? And how do you distinguish those that plan on getting a test and those who don't want to get a test? And how do you find the balance between those 2 groups of local people returning to the islands?
A lot of good points and critical discussion points here. Okay, so first, the easy part. If you go for more than six days, okay, if you go for more than 6 days, you'll be treated like any other traveler, and that's actually constitutionally necessary. Okay, so if you're gone for more than 6 days, whether you are a resident or a person that's coming back and forth several times, you'll have to get a test if you're gone for that long of time. If you're gone for less, you just go for 3 days to Vegas or LA or wherever for business, it is obviously not valuable to get a test the day you arrive, and then you spend 3 days there and then you come back. It's of no value. The recommendation that's being used in some municipalities to do a test 4 days after return, and we will finalize whether or not that we adopt that also. The easiest thing to do, and the current policy, the policy as of this moment will be, you will be asked to quarantine after return until you're cleared. A lot of people have exemptions, and if you are in an exempt worker class like we already have, you will be exempt. You'll be able to go to work, and then you go back home. So a lot of people, if they're traveling for business, they know that they're in an exempt class, then they're okay. They're already cleared. If you are not, you're taking a vacation and you are putting yourself at increased risk to go somewhere where there's a lot higher rates, because everywhere is higher rates. And that hasn't been finalized, but people who go to Vegas may actually still have to, if they don't have any other way to get out of it, face the quarantine. I think that the better policy overall will be to get a test 3 to 4 days after return. That we tell people you are quarantined and you will be released from quarantine when we have a negative test. There are some challenges with that because 15% of all of our individuals coming inbound back to Hawaii are our residents. That is not a small number, and we don't have infinite tests. If at 15,000 people, I keep using that number just to give you perspective. If it's 15,000, that would be 2,250 people every day coming back, which would mean on the fourth day, you'd have to commit about 2,200 tests to clear them. My preference, and it's not one that people love to hear, but I'm not going to shy away from, real advice. My preference is people do not take those short trips right now, because those short trips put you at risk. It puts us at risk for extra surges in Hawaii, which could shut us all down. And I know people want to get off of the rock a little bit, right? But it would actually be better if people went on longer trips and adhered to the protocol and got a test. They would not have to worry about the potential quarantine. They would be in the same boat as everybody else. And I guess what I'm saying is, if you're going to take risks, get your money's worth for it, because then we can have a good protocol for you. But in the next 10 days, I will have very clear guidance for people about what the formal policy will be.
Ryan, there's a question that's about these clusters. It's a little closer to the top. Malia Soon says, the current high numbers of cases, how many clusters are they linked to? Are we testing contacts for the clusters? Are the clusters under control, in your opinion? We've had so many mixed days recently where, yesterday, for instance, 16 new cases, 1 removed, but still double digits. When, in May, we kind of got used to these single digit days, even 0 for Oahu and different islands. So
Right.
Can you tell us a little bit, give us a little bit of sense when we see these double digit days, what that means? Are these clusters, and what's the contact tracing happening right now?
Yeah, that's a great question from Malia. So about half of all the cases have been clusters. They've been contacts with family members. The contact tracing has been working. They've added a lot of extra contact tracers. We finished the training of 160 people already, and they're training another 320 people. So by August 1st, we will have this huge fleet of people that the Department of Health will have the capacity to hire on basically 90-day contracts if we have to bring people on, so they could trace a lot more people. So when you see a number like 16, it's been about 8 people associated with family just directly in that cluster, and 8 new cases that we've picked up. That's been kind of the pattern. I have a lot of conversations now with other governors and lieutenant governors, and it's interesting because they look at our numbers and they're like, you got to be kidding me. Why are you worried? Right. And, knock wood, we haven't had a fatality in 6 weeks, more than 6 weeks. So it's really pretty unbelievable how good it's gone. But I don't want it to get worse and then spiral out of control. Right. So that's the answer to her question. It's half. And there have been a few days where it's been a big cluster. They are under control. Waipahu had a burst of activity and that settled down. There was a burst of activity at Halinani that settled down. So this is what to expect. Little mountains, okay? And I think the next time we're going to see a surge is after July 4th weekend, which is coming up. We got Friday, Saturday, Sunday coming up soon.
And to talk a little bit more about those contact tracers, to get a little more clarity on that, we know that they're the ones that kind of go out when there's a cluster or when there's a positive case that has been confirmed. But going back to sort of the finding, to really holding the people accountable who say they are self-quarantined, who's responsible for that? Who's checking up on those who are in those 14-day quarantine? So for those people who maybe don't get the test when they come in, is it the contact tracers? Is it a new position that's going to be responsible for checking up on these residents or visitors, just making sure that they adhere to these 14-day quarantines that they've decided to go through?
It's a lot of people. So there's Department of Health, there's public safety, there's law enforcement from the counties, which is the heaviest lift. And one thing that we've come to agreement on is the mayors wanted to have more kind of accurate information on who was adopting the quarantine position and who wasn't. It's going to be very critical that we're accurate about that when we have a lot of people coming in, right? And we expect everybody to accept the fact that they have to have a test, because the penalties are too large if you get caught. So We're going to give very specific information about where people are staying. We're checking their contact numbers so that we can contact them. People have been frustrated by this, but we're checking people's phone numbers that they give us so that we see right in our real time in the line that that's their phone and that they're reachable. If people choose to break the quarantine and they don't respond for several days, some people are going to get caught. And we've had to empower the mayors. They were very, very clear about wanting to have this set up before we opened up travel, trans-Pacific travel.
Kayla has a question. Kayla Chimola says, address the 72-hour window since it's not feasible. This is a huge concern for returning residents and travelers. There is this concern that these labs might not be able to turn around these tests within the time frame, and then these travelers would get on a plane and be forced to quarantine and face all of that. How can we guarantee that they can get results fast enough to meet this guidance?
There's two ways. One is that the average length of time is 2.1 days for CVS, for example. So if people go get their test 3 days out, almost everybody's going to get their lab result back the day before they travel. If they miss it by a day, they'll spend 1 day in quarantine and have to lay low. And it's just the reality of the COVID era. Also, if the molecular test does ultimately get approved, which is the Act Now test that's on Abbott, that test is a rapid test, and it is an accurate test, although some people have pushed back on that. They've recently done a very good study up in Alaska and confirmed that it's been accurate enough for their needs. So that test is readily available. The bigger problem would be if some region just says, we have a huge burst of COVID and we just can't do any testing, we can't allow for any. I don't think that that's going to ultimately be our problem, but that's why I'm putting in multiple redundancies. And our returning, that is a problem for tourists, basically. That's a bigger problem for them. For us, we've had more than enough capacity here. Even if you did have all of the returning travelers as of now requiring a test, we have way more than we need capacity. I don't want to put that burden on the system, but we do have the capacity.
And April's asking for a clarification, which is actually an interesting one. She says, is the 72 hours before flight time or arrival? For people flying a long distance, this could make a difference. So when is that? What is that actual window?
It's before arrival, actually.
Okay, so so the minute you land, it's 72 hours back, basically.
Yeah,
okay.
That's right. Yeah, so and we had this debate about whether it should be 3 to 5 days. Honestly, that would be enough. That would be safe enough if you're asking me. Because the probability of catching the virus after being tested 3 days out or 5 days out is very small. I mean, it's 1 in several thousand that you're going to catch the virus. It's not nothing, but that would give us more wiggle room, and I would have been more comfortable with that, because then you could have guaranteed 5 days out, everyone's test result will get back.
Well, and I would hope that those folks, once they get that test, would take a little responsibility and lay low, right? Like, you're going on this vacation, like don't go to a movie theater or what have you. Don't, go to a large gathering the day before your flight to Hawaii. I know we can't mandate that, but I would hope that there would be some kind of, what kind of messaging are we giving the visitors so that they are coming here? This whole idea of traveling with aloha that you've talked about, how do we try to instill them to be responsible before they even get here?
Man, if they're like my parents, they'll be packing for like 3 full days before. So they'll be very, very safe. But we have to hammer that home. And we're going to do a huge public service announcement campaign. You can imagine all of the airlines are going to be very, very diligent about sharing over and over again the rules about when you need to get tested. They will have a lot of reminders that, like Hawaii and Alaska and United American, all these guys are going to be able to say, let's say you're traveling on August 10th, you're going to get emails the 7th, the 8th, the 9th. Please make sure you've completed your test and you have your result in hand if you're traveling to the Hawaiian Islands, So we will tell people enough. And I'm going to be on television, and so will many others, explaining this. It is a small price to pay, because remember, there's a big benefit also to the travelers themselves. The travelers that are coming from all over the world will know they're getting a vacation where there is the lowest rate of COVID in the world. And they are also getting the benefit of a time when there's very few people here compared to normal. So this is a good opportunity for people, if they're traveling with Aloha, to be safe, but to go to a place that's much safer than where they live, honestly, and to spend a lot of money, I think, on tourism. But it's okay that people have saved for their lives to come to Hawaii. They're going to have a better experience than usual because, I'm sure you guys look pale to me, but I'm sure you've gone to the beach sometime not so long ago. If you go to the right beaches, there's nobody there.
Mm-hmm.
And, if you go out to a restaurant, we've been staying in pretty much, but many restaurants have a lot of extra capacity and space. So it probably is a good time for people to travel safely, but we're going to have to hammer that message home a lot. And I hope that people are listening to your show because it's really simple. I'll come back to where I started. You get a test within 3 days of arrival to Hawaii, and then when it's negative, you come in and have your vacation. It's really that straightforward. And we will provide on our websites in the coming days all the places in America you can go and clear indication of which tests. And that will decrease our rate of infection and risk really seriously.
All right, Lieutenant Governor Josh Green, thank you so much for being generous of your time. We know that you're busy and that there are a lot of people that want to talk to you and ask you questions, but we appreciate you always making the time. It's been a pleasure once again to spend this time with you this morning.
Thanks. Good luck with the mayor candidates.
Aloha.
Thank you. Wow. Well, very interesting. Great to have him break all that down. Interesting what he said about children in particular, this issue of minors, and is the whole family tested or just some family members tested? And it sounds like they're still figuring out what that threshold is. It sounds like he believes it should be anyone over the age of 12. So we'll see. And that could be, as he said, a huge burden to families if this is a family destination. And if you have to get, 4 or 5 people tested at $160 a pop, that could be pretty cumbersome for a lot of people.
Yeah, and it's obvious that there's still a lot of details that need to be worked out here,
Mm-hmm.
and they're not hesitant in saying that they're still trying to figure things out. They have obviously set this timeline of August 1st, but there are questions about those short turnaround trips. I mean, he's even saying, if you are going, I think he said, make the most out of your money. Just stay longer on the mainland for those who are leaving the state and those residents that want to come back. The reality is, though, people are leaving for business. Sometimes they only can afford to go away for a weekend, but they also have to take into consideration now, as he said, that all these returning residents coming back into the state, they have to be prepared to potentially quarantine in place until they get their test results back. And we also have to look at those numbers, as he mentioned, with the influx of returning residents that are going to be coming back from vacation. That could exceed that 5,000 limit, a number of tests that they do daily. So if those incoming residents really add to the amount of tests that the state is doing, that could also pose some problems. So they're looking through all of these things. And we thank all of you for many questions and comments because there are still obviously a lot of questions around this process.
Yeah, and this process, as he said, he's working it out day by day. He was on the phone bright and early this morning with Alaska and also with the folks over at CVS. We know that these talks are continuing every day, and on Monday, the governor will be joining us. So hopefully he'll be able to give us an update. We know so many of you are concerned, whether you happen to work in the travel industry or, an industry that's affected by that. Or, you're a resident of Hawaii and you're concerned about people coming on planes and bringing the virus here. I think all of us have a stake in what this plan is and how it is rolled out. Also interesting to hear that international visitors will be welcomed back, provided that, of course, they are allowed to travel to the United States. There are some larger policy questions there. It's country to country, right? And then, they'll have to have a lab that does the specific kind of testing that he's talking about, but we won't just see people from the mainland. We could potentially see people from other countries if they provide that testing as well.
That's right. And I know that there are many questions that are still coming in. Obviously, he's not with us, so we can't ask him. But there are a lot of questions that were repeat questions that you maybe missed in the earlier parts. We always recommend that if you missed part of it, please go back and watch, because a lot of the questions that are being asked right now were actually addressed by the Lieutenant Governor earlier on. And we encourage you to go back and take a look at that. Obviously, there are still a lot of other headlines that are happening here in Hawaii. We encourage you to head on over to the paper, as there are some breakdowns of some other headlines, including the unemployment benefits, with $16 million of Hawaii unemployment benefits possibly lost to fraud. And so we encourage you to go over there and take a look at some of those, because those numbers are pretty alarming when you look at the amount of money that could potentially have been lost there.
Yeah, and so disheartening because we know there are still people who are waiting for unemployment benefits, and to hear that people who did not deserve them have made off with that money, and to that degree is pretty tough to read. You heard the lieutenant governor there make mention of the mayoral candidates, giving a little preview of something that we've been telling you about. This is the last full week of this program. We have been here since the end of March, and we have enjoyed every single day. We love being here. But we are shifting the conversation. So next week we'll do Monday, Tuesday, and then following the week after that, so July 6th, we launch a variation on the theme. We're giving ourselves a new title and a new focus. We're kicking off a program we're calling Spotlight Hawaii, because we are shining the spotlight on different issues. And Ryan, the first 6 guests, we've already booked them all.
That's right. We're going to be talking to the 6 candidates that are running for Honolulu mayor. And we will be kind of giving them an opportunity to share their vision for what they plan to do if elected into the role that they would ultimately assume beginning next year. So it's an opportunity for you to engage with some of these candidates. We had set up a criteria. Obviously, there are more candidates than 6, but it was a criteria that was set up by the editors and the staff at the Honolulu Star-Advertiser. And so we will be speaking to them and allowing you the opportunity to get to know more about where they stand, how they would maybe combat COVID-19 in the months and years moving forward, as well as other issues. Of course, we know rail is a hot topic. There are also things that are concerning to many residents here. And so we'll be getting that conversation, again, as Angie said, in July.
Yeah, we're really looking forward to that. Thomas Sase says, who are some of the candidates running for mayor? We'll be kicking off the first week with Colleen Hanabusa on that Monday the 6th and Mufi Hanneman on that Wednesday the 8th. And we will roll out the full program for you. We don't necessarily need to tell you all that. Just reserve your Mondays and Wednesdays starting July 6th, 10:30. We'll see you right back here then. We always like to end this program with a Hawaii hero. And today we are talking about Hawaii Health and Harm Reduction. That's a Hawaii Food Bank partner. You can see them in action right there. They've held 11 distributions in the Pupukea area, distributing over 90,000 pounds of food to folks on the North Shore. Specifically, they've provided food assistance to more than 6,000 adults, more than 3,000 keiki, altogether 2,500 families. So we mahalo them. Our Hawaii hero today, Hawaii Health and Harm Reduction. If you are a family that is in need of food assistance, remember you can always head over to the Hawaii Food Bank's website. They have dozens and dozens of food distribution sites. Aloha Stadium is not in action anymore, so to speak, but there are plenty of places where you can still get food assistance. So please check out the Hawaii Food Bank's website for that.
Yeah, and always great to highlight some of those great things that are happening here in our community. Again, we encourage all of you to join us right back here on Monday. We will be talking with Governor David Ige, as Yanji mentioned earlier, about, of course, this sort of the ruling and the rollout of this lifting of the 14-day quarantine for out-of-state visitors to the islands. And so we hope to get more information from him there. We encourage you to come back here and, of course, enter your questions. We always know that these guests get a lot of questions, and that there's still a lot of questions and thoughts and concerns about this process. So we encourage all of you to join us then, again, 10:30 with Governor Ige. And then on Tuesday, we'll be joined by another special guest to sort of wrap up this COVID-19 care conversation.
Yeah, we're so excited. We're having Mike Akane from the Hawaii Community Foundation. We've talked a lot about the Hawaii Community Foundation and all the amazing work that they've been doing through this pandemic. They have been amazing community partners to so many organizations, helping to stand up food distribution and, you know, among so many other efforts that they're taking. So we want to get a check-in from him. He really knows where the need is in our community, and it'll be really interesting to get that perspective. Where's the need? How is HCF moving forward? They have this amazing resource called the Resilience Fund, which a number of banks and other organizations have donated to. So what's the plan for that? And, you know, how do nonprofits move forward in the age of COVID? So we're really excited to talk to Mike Akane on Tuesday.
That's right. So until then, we will, of course, thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for allowing us to have this conversation with all of you. We thank you for tuning in. We appreciate your comments and for being a part of this conversation, and encourage all of you, have a great weekend. Be safe out there. We'll see you right back here on Monday at 10:30 with Governor Ige. Aloha.
Aloha.